bringing about change in the mental health care system across the country. It's what a local behavioral health organization says a two-day meeting was about. Our Joe Harris stopped by to talk to those involved. Joe, what do they have planned?
Well, Aaron, organizers say mental health care in this country needs some shaping up. But they say the science behind how to go about it is already there. It just needs to be distributed.
Dr. James Sorrell is a medical doctor and psychiatrist at Methodist Hospital in Fremont. He says in the 30 years he's practiced medicine in Nebraska, mental health in youth hasn't seemed to be getting better.
We see a lot of kids in crisis. We're seeing them in the emergency rooms. The schools are struggling in ways they've never had with it, and the resources that are available in some levels are diminishing.
And that has an impact on their physical health.
Kids with mental health issues are more likely to end up taking poor care of themselves. They're more likely to end up with substance abuse issues, which contribute vastly to poor medical outcomes.
He was one of more than a dozen mental health and medical professionals from around the country who took part in a group meeting the behavioral health group Omni Inventive Care hosted at the Farnham Hotel Friday. It was actually a follow-up to a similar meeting of minds Omni held in August.
Science exists. There's good science related to the treatment of mental illnesses in children.
Dr. Ray says mental health care in the U.S. has deteriorated over the last 35 years, and that what participants got out of that August meeting is that the science for treating mental health is there. It's just not well organized or easily accessible.
We recognize that we really needed to get the best science into the hands of people who need it, including consumers, parents, so they can evaluate whether or not the therapist for their child is actually providing the best care.
And they say it comes at a crucial time. According to the Journal of the American Medical Association, the number of youths hospitalized for mental health increased between 2009 and 2019.
The difficulties many of them were exacerbated by COVID. Disruptions from school, from the social supports that in homes that are struggling. They became more isolated.
So they're launching the National Behavioral Health Revitalization Plan. Keeping true to one of its 4 pillars, they aim to transform how mental health care in this country is done. Ray says they've spent Thursday and Friday planning on how to do that, like pushing forward initiatives for changes to policy, practice, and academic training. That would include advocating for legislation and also meeting with licensing boards and professional guilds.
The curricula at universities is old. It doesn't stay up with the science.
The hope is that this would shift how counselors, social workers, and prescribers treat mental health so people can get the treatment that fits best.
Now, Dr. Ray says he's never attempted something like this before. However, he feels confident that health professionals and policymakers that this group reaches out to will be receptive to what it has to say. Live in the newsroom, Joe Harris, 6 News.
Thanks for that report, Joe.